Hello and welcome. My name is Suzanne Norris. I am the facilitator of the Senior Compass Project with the Northeastern Manitoulin Islands Public Library. The Senior Compass Project is funded by the New Horizons for Seniors Program, Employment and Social Development Canada. This program provides funding for projects that make differences in the lives of seniors and in their communities. Today, we will be speaking about elder abuse. This webinar is the second of a series of information videos directed at accessing services and support in our community. I'd like to welcome Sheila Schuehlein from Cape Breton Island. Hi, Sheila.
Hello. Thanks for having me, Suzanne.
Thanks for being here. Sheila is the Regional Elder Abuse Prevention Consultant serving Northern Ontario for Elder Abuse Prevention Ontario. She is a gerontologist who has developed, facilitated, and evaluated health promotion initiatives for over 25 years. In 2014, Sheila returned to school, graduating from Duke University and earning her medical board certification as an integrative health coach. Sheila was honored to join the Elder Abuse Prevention team in July of 2016 and is passionate about enhancing the resiliency of older adults and reducing the social isolation and vulnerabilities often associated with aging. Hi again, Sheila. Thanks for joining us.
Thanks for that introduction.
Yeah, and the first question is, what is elder abuse, and how can you help us sort of get an idea of what that looks like in your position?
Well, we can start with the definition that comes from the World Health Organization. That's definitely the one that we refer to most in Elder Abuse Prevention Ontario. And it's an intentional act or failure to act by a caregiver or another person in a relationship involving an expectation of trust, and that ultimately causes harm to an adult 60 years or older. So you see a couple of components in there. You see an age, 60 years and older, although, with Elder Abuse Prevention Ontario, we provide consultation to some, to those who are younger, as well as to family members. But the other key piece that I'd like to point out is that expectation of trust. So usually as we talk, as we go on in our conversation, we'll probably talk about who commits these kinds of abuses. And it's always someone who, is in that position of trust. I also want to say that although we're calling it elder abuse because that's the term that most folks refer to it as, that's what it's known as colloquially, I try my best to make a distinction because our Indigenous communities, elders mean something else. So seniors abuse or abuse of older adults, those are better terms to refer to.
Mm-hmm.
So the other thing I'd like to let you know when we're talking about elder abuse is that it's pretty complex. 80% of cases are, reoccurring. So if we think of, this is probably a good example. If we think of someone in a mall, an older person walking, and some thug comes and pushes that person to the ground, steals the person, runs away. Is that elder abuse? Well, that was a physical assault on an older person. So, it is elder abuse in a way, but there wasn't an expectation of trust between that person and the older person. So that is definitely a crime, and it is, it's abuse for sure, but that kind of gives you some of the distinctions potentially. The most common categories for abuse, really, we're going to talk more about this, I hope, is financial exploitation. And so some of the frauds and scams fit in there. But again, although we work with frauds and scams, sometimes there's not that expectation of trust in those scenarios. There's also emotional and psychological abuse and neglect. That can include verbal abuse. That's very prevalent. Physical abuse is another type of abuse we consult on, abandonment, neglect, as well as self-neglect.
That's a lot. That's a lot that encompasses that actual term of elder and senior abuse. Yeah. Okay. Thank you for that. I guess the next question I want to ask is, why does elder abuse happen? I know you originally said it typically happens with people of trust. And, the question is, so why does that happen if the person actually knows them or has a relationship with them?
That's the hardest part to get your head around, isn't it?
Yeah, it is.
Yeah, seniors abuse really, it wouldn't occur if there wasn't power and control dynamics, right? Oftentimes with the financial abuse, we see, a family member thinking it's my time to take over the finances and I'm going to spend them how I want at the detriment of the older adult. So really it is that power and control piece we need to be aware of. And in some situations, the abuse might be, externally motivated from addiction issues, drugs, alcohol, gambling issues, mental health problems. These days with the COVID experience, people being in isolation together and not having outlets to work on anxiety, sometimes we're seeing much more, many more calls into our lines. Really, it can happen when an aggressor really just wants to intimidate, isolate, or dominate control. So it could just be simple as someone having that type of personality who wants control, and here's someone who's vulnerable.
Okay, those are good points. Thank you for that. You already spoke a little bit on this. Who abuses seniors? We already spoke about the trust issues and somebody within your known circle. Can you elaborate on that?
Well, unfortunately, it can come from anywhere within that network of people that you know. It can be a family member, it can be a friend, it can be someone who provides assistance with basic needs or services. We see it as financial advisors. We see it, in people who are providing, healthcare. It can even be in institutional settings. There's been lots of dialogue around that in the COVID-19 experience as well. It's really seems to happen when an older adult becomes dependent on someone else, and when they need to rely on care or support, that they're at highest risk. Okay,
all right. And when I made this next question up, it's interesting. It's almost like a dichotomy. Why does elder abuse remain such like an invisible problem? And yet it doesn't. But if you can sort of elaborate on that and speak to that specific word, invisible problem.
Gladly, because part of what we're really mandated to do for the provincial government is to bring it out into the open and to create an awareness about this as a very serious and increasing issue. And you can understand in a way why it remains invisible, because if this is a family member perpetrating an abuse on you, do you want to, quote unquote, air your dirty laundry in public? So people feel embarrassed. They're also afraid, and that's a really hard part of the job, is that I want my family member to stop treating me this way, stop hurting me, but I won't press charges. I won't, I don't want to get them in trouble. Oftentimes the perpetrators are very good at keeping it invisible, because they say things like, well, if you tell anyone about this, I'll be putting you in a nursing home, or you'll never see those grandkids again. So those intimidation threats have a lot to do to make people not want to share. Sometimes they feel guilty, and they're, the victim blaming, they feel that they're somehow to blame for what's happening to them. And a lot of times we see people who are in denial. I've talked to people who explain the circumstances, and they don't even, a circumstance they're experiencing, and they don't even really see it as elder abuse. They're starting to wonder if it is. So sometimes it's denial, and truly people often don't want to report it or do anything about it, because if I say something, will it get worse?
So the denial piece, do you think that the denial is almost like, I'm not quite sure if this is what this is? Is that part of that denial piece?
Some of that can be, yeah.
Yeah,
you don't have friends and family. That's why it's so important that communities step up. If you don't have friends and family that you can talk to about that, you may suffer, in silence, because you're not really sure, is this how it is for, when my son or daughter has a bad day and comes home, pushes me around, or yells at me, is that what happens to most older adults, or is that abuse?
Right. Yeah. Okay. Thank you for that. What are some of the indicators, or maybe the things that jump out at us that we can sort of help with elder abuse and sort of notice what they are, so we know that it is actually abuse or neglect?
Yeah, senior abuse can be really difficult to detect. I have a list here that I'll go over with you because I knew I'd get asked this question. But the one thing I want to say is that changes in a person's behavior, changes in a person's personality, you know, those are often the first signs. Someone who's been outgoing, participating in, you know, in lots of activities in community, who begins to withdraw without any known reason, maybe mobility issues or something, like a person withdraw. But you know, if you're seeing those changes, it's time just as a neighbor to have to ask and check in and see how things are going. You know, it's really hard to be able to detect it unless, sometimes if there's unexplained injuries, you'll see it visually, but otherwise we have to just check that person to see if there's an increased level of fear or anxiety. If they seem depressed without any reason. We'll also look at, when we're looking at care institutions, or people living on their own and expecting support from other agencies or family. Is there dehydration? If you open the fridge, is there nutrition available to that older adult? Are they, are their coat, do they have a winter coat? Can they, are they properly clothed? How's their hygiene? Improper use of medication. Medication abuse exists. So that can be one of two ways where someone takes the medications away from the older adult that they need for pain management or to survive, and sells them or does something else with them. So the older adult is not getting their medication. But the other way it's often used is over medicating. So medication abuse is something else to see. So if someone says they haven't had their medication available to them, that you might want to probe that a little bit more. Confusion about new legal documents, or if you ask them questions about their finances and they really don't know or don't